I'm Rachel Long, and today I'm going to be doing the blood administration scale. I'm going to start with my 12 safety practices. I would verify the care. I would then perform hand hygiene before and after each procedure. I would verify procedure and gather my equipment. I would check the manufacturer's recommendations on the equipment. I would then knock on the patient's door, use two identifiers to identify the patient, note overall health of patient, provide for privacy, and explain the procedure, raise the bed for good body mechanics, don proper PPE. Once I'm done, lower the bed, provide collate and lower side rails per care plan. I would then document the procedure, and if any abnormalities are found, report to the charge nurse. And then if I give any IV push medications, make sure my instructor is present. Now moving on to the blood skill itself. First, I would verify the healthcare provider's orders, make sure I have the right blood administration, the right date, time, duration needs to be given, and any pre or post medications that need to be given as well. I would then obtain consent per policy. I would assemble the blood administration kit, make sure I have a filtered tube and flush with normal saline, and check any manufacturer's instructions that need to be done with that as well. I would then obtain baseline vitals for my patient. Before I obtain the vitals, I would obtain a venous access using a large gauge needle. And then I would obtain vital signs for a baseline, as well as an urinalysis, make sure I note the skin color, any history of any transfusion reactions, and I would also check my labs, my H&H, any coag studies, and any platelet studies as well, and make sure it's all in the patient's chart. Then I would verify with a second nurse the patient's name, identification number, blood type, blood compatibility, blood expiration, and duration that it needs to be given. I would then get my blood. I would agitate and make sure there's no abnormalities within the blood. And then I would initiate the infusion per policy. And once the infusion is initiated, I would stay with my patient from 15 to 30 minutes to check for any reactions that may occur. If I see a reaction, I would immediately stop the procedure. And if I don't see a reaction, then I'm going to increase the flow per prescribed to make sure my duration is within the 4 hours. I would then obtain vital signs per policy, however frequently it is prescribed to do so. I would document my findings, and I would specifically document how the patient handled the procedure. And that is it. Thank you.